Coordinator of Veteran Services here at Towson University. This is the first in our video series of informational sessions for student veterans. We're going to be introducing Phil Munley, as well as Russell Biondo. And before we do that, I'm going to have Jake Wolf and Charles talk a little bit about Vital, before we have Phil Munley talk about veterans benefits available through the MDVA.
Thank you, Patrick, and I appreciate you all being here. I'm hoping that as we go along, we might get a couple people in, because I think we're going to get some really useful information. And I know the faces that are in the room now, but just to remind you all, what's brought me to the Towson campus is an initiative through the Veterans Health Affairs called VITAL, Veterans Integration to Academic Leadership. And that's really developed as a program to be a bridge between local colleges and universities and the medical sector. So helping folks to get enrolled in VA healthcare, answering your questions about benefits, education, so on and so forth, mostly to keep you all supported and focused on your academics and get you through that. I'm also available here on site Tuesdays from 11 to 1, and also by appointment if that's something that you'd like to sit and talk with me about. And I can address a lot of medical issues as well as mental health issues if that ever becomes a source of concern for folks. So please do feel free to visit me or talk with Patrick about getting in touch with me to sit down and chat for a little bit. I also have enrollment forms here, so if anyone is not enrolled in the VA, I can talk with you about that. I was talking to someone earlier today saying that regardless of your situation, I always recommend just go ahead and enroll in VA healthcare. Even if you don't use it, that's okay. Just go ahead and enroll, because at least it's there for you. God forbid something comes up and you need to utilize it. But we can talk more about that later if you guys have questions. So without further ado, I'll ask Philip Munley to come up, and I'm going to send in the sign-in sheet as well.
Okay, well, good morning, everyone, and I'd like to start by, of course, thanking everyone here and everyone that may be watching the video for, of course, their service to our great country. I want to thank Patrick and Jade for their invitation for us to be here today and talk about services that are available to you through the Maryland Department of Veteran Affairs and benefits that you've earned through your service to our great country. A little bit about me before we even get started, just so you know a little bit about my background. Of course, I'm a retired Navy guy, so I'm very happy that this Saturday the Navy beat the Army in their 11th straight Army-Navy football game. And I'll be playing that up for a year, so when you come to visit us, you need to know that in advance.
You know what side is on.
That's exactly right. So again, I'm a Maryland native. I joined the Navy out of Catonsville, did the regular route, spent 5 years on a ship in Norfolk, Virginia. Was fortunate enough to spend 12 years here in Baltimore as a recruiter. Spent my last 4 years in California, where I retired, and spent 13 years living in California, returned here back to Maryland about a year ago, where I now represent the state of Maryland, helping veterans access benefits earned through their military service. Through the state of Maryland, we won 4 different programs, and I think it's important that you know about each program. Our program is the Service and Benefit Program, which we're going to get into some detail in just a minute, but you should also know that we also run an outreach and advocacy program. And if you go to our Maryland website, www.maryland.gov, you can register to be a part of our email list. That email list, what they do is they send regular emails on a number of different topics. A weekly job announcement report where employers actually contact the state of Maryland looking for veterans to hire to their company, and we post a list of those companies that get in touch with us on a weekly basis, and then we email that out to those who have registered for our list. Changes to VA regulation. The one thing that is constant about our job in dealing with the VA, the United States Department of Veterans Affairs, is that it is forever changing, and regulations are constantly changed, and that email list will make you aware of changes to VA regulations. Some are going to apply to you and some that aren't, but it's good information just to have, and just information about different veteran events that occur throughout the state of Maryland. So that's through our outreach department, and if you go to www.maryland.gov, you can register for that email list. And just so you know, if you're uncomfortable and you're getting a bunch of emails from them and you don't want to receive them anymore, you can always unenroll, I guess they call it, or deregister, to come off of that list. So that's our outreach program. Maryland also runs a cemetery program. We do have 5 state cemeteries in Maryland. Every veteran who veterans in the state of Maryland are eligible to be buried in any one of our 5 state cemeteries at no charge. And that includes the marker, the headstone, which is also at no charge. The marker is actually a VA marker, but the state burial in the state cemetery, excuse me, is at no charge. If there's a spouse involved, we do charge for a spouse to be buried in a state cemetery. It's a minimal charge of $600. Excuse me. And that's for the opening and closing of the grave. And I know these things are not things that we like to think about, burial or demise, but it's something that it's a good thing to think about, in that if you can make any type of pre-planning or pre-registration, making things easier on your family at a very difficult time for them, at a time of need for them, it's always something to put that. It's good to put that stuff in writing, thinking about your family. So we also run the Charlotte Hall Veteran Home, where veterans can go to live. There's an assisted living, skilled nursing facility within the Charlotte Hall Veterans Home. We also run that through the state of Maryland. So those are just a couple of things, some of your benefits that you earn that we administer through the state. Excuse me. Our program, of course, is the service program. And the service program, our job is essentially to be your advocate in dealing with applying for benefits that you earn through your military service. So one of the most common questions we get asked, well, why do we need the state of Maryland, or why do we need to be spending taxpayer money on a service program when I have the VA? And it's a very good question. And the answer to that question is, of course, is that the United States Department of Veterans Affairs is broken into 3 separate and distinct elements. Those elements are veterans health care, veterans benefits, and then national cemeteries. Those 3 elements of the one VA do not always share information with one another. So it is always in your best interest, prior to applying for your benefits that you've earned, we're not giving you anything here, you've earned these, that you work through an accredited rep that can help break down the VA process and explain things to you in order to present information to the VA in order to give your individual application or claim its best chance of success. And that's why it's just so critical. We also pass out just general information about benefits. And I'll be honest with you, that's what we find, is there is a lack of knowledge about specific details and programs that are available for vets through the VA. So that's why it's kind of important, thank you, that you work through an accredited rep in order to help you get what you've earned. And if you happen to listen to a couple of bad jokes about the Army or the Navy, then it's a small price to pay. And Patrick, of course, I forgot to mention, Patrick is a Marine Corps vet. And the reason we do win those football games almost every year is because we have the Marine Corps playing for us.
That's true.
So I want to talk about a couple of programs today that are administered through the Veteran Benefit Administration. The first program I want to talk about is disability compensation. And that's where you establishing service connection for an injury or an illness or a disease that's associated with a period of active duty. And I'm going to go into some detail just to kind of make that process or give you some background so you have some knowledge of that going into this. There's 4 ways in which the service connection for that injury, illness, or disease that could be associated with your period of active duty. And the first way is direct service connection, where that condition is documented in your service medical record, and as a result of that injury, illness, or disease, you have some sort of a chronic or a long-term residual disability associated with that. The VA does not rate acute and transitory illnesses or diseases, and a good example of that is you fall, you sprain your ankle while you're on active duty. Your ankle heals, and you go on and you really have no other issues with it. There is no residual disability with that. That's acute and transitory. That is not something that the VA will rate. For example, a vet, and the example I use is, you're serving overseas and you're shot in the shoulder, for example. the VA is not going to rate the fact that you're shot in the shoulder, because while you're on active duty, you know, you're going to be treated. They'll operate on you, they'll take the bullet out, you know, you'll go through physical therapy, rehab. What the VA is going to rate is what is the residual condition of that injury. How far can you now move your arm, or what is your range of motion? That's the residual disability that you're experiencing of that, and that's where the rating actually comes in. So that's direct service connection, where that condition is documented in your service medical record, and a verifiable chronic or residual condition exists from that initial injury. There's secondary service connection. For example, over the course of time, you know, you may, if you have this shoulder injury, you may be overusing your other shoulder, and over the course of time, now you've developed some other type of condition in an opposite shoulder, arthritis, a number of things can occur. If that does occur and the doctor says the reason you're now having this is because of the original injury, then that original one is secondary to the original condition, and you can file a claim to service connect that on a secondary basis. So we've talked a little bit about direct service connection, and now this is discussing secondary to the original injury. And it applies to many, many different conditions. So the point here I want to make, if you think that you have something that fits into these categories, that it is absolutely in your best interest to contact an accredited rep through the state of Maryland. And here at the Vet Center at Towson University, we've left our contact information and some handouts that you can kind of pick up and take with you. We have 9 remote locations throughout the state of Maryland. So if you don't, even though you may be attending Towson University, but you live in, you know, Hagerstown, I have a rep in Washington County and in Hagerstown. And if it's most convenient for you to use that rep, we will assist you there. So I want to make that point as well. So we discussed direct, secondary. There's also aggravation of a pre-existing condition. And aggravation of a pre-existing condition is where we all join the military course under presumption of soundness. However, if you have a condition upon entering, the military accepted you with that condition. However, it's aggravated beyond the normal rate. The VA can rate the degree of aggravation to that condition. A little bit tougher claim to file, but with the help of a rep, they can help you put that together if that's what your issue is. And then the last way is what they call a presumptive provision of VA law. And a presumptive provision of VA law essentially deals with exposure. For example, for our wonderful Vietnam vets, if you served in the country of Vietnam, then you were exposed to Agent Orange. The VA has developed a list of what they call presumptive conditions related to that exposure to Agent Orange. And if you're ever diagnosed with that condition in your lifetime, the VA can link that back to your military service. That deals with presumption. There's other ways, for example, radiation exposure. There's a number of different things. If you think you fit into any of these categories, again, you want to contact one of our reps to kind of help you through that process. So, how does the VA do this? Once you file a claim, it'll go into the VA system, and at the VA regional office in Baltimore, which handles our area, they have about 30,000 pending claims right now. The average claim processing time there in Baltimore can be between 18 months to 2 years. And you know, that's just the way it is. Working through the rep, our goal is to submit things to kind of shave as much time off of that as possible and kind of explain the little intricacies of how to get that thing through in the most expeditious manner possible. So that you want to work with the rep kind of to get that claim through. Now, when we're successful, or if we're successful, the VA awards disabilities in degrees of 10%. They start at 0. And a good example of that is, you know, if you receive some kind of a cut or a laceration in service, you know, they stitch you up and it heals. Again, there's no residual disability there, so they wouldn't rate that. However, even the scar, you know, if there's a residual scar, the scar can be considered a service-connected disability because it was caused by your military service. Those type of things are generally rated at 0%. It happened to you, it happened in service. However, it's not severe enough for them to compensate you for. There's no monetary benefit. that's associated with that. So they start at 0, they work themselves up to 10, 20, all the way up to 100%. And just as an example, currently, or the rates just went up December 1st. The old rate was $127 a month for 10%, $253 for 20, all the way up to 100, which can pay $2,900 a month. So that's kind of how they do that. There's other ancillary benefits that kind of go along with each rating depending on your level of disability. I've left that sheet here at the Vet Center as well, and you're welcome to contact us for a detailed review depending on what your percentage is. If you get receive benefits at the 30% rate or higher, they do add a small allowance in for spouse or children. So if you're married and you have a rating of 30% or higher and you have children, you'll want to apply and make sure your wife and children are also on your award. A common question I get asked is, does the check go directly to the spouse or does it come to the vet? And of course it goes directly to the vet. There's only one check sent, there's only one payment sent. And it's not a lot of money either, so but you do want to make sure that they're on there. Okay, so that's kind of the VA compensation program, quick and in a nutshell. And I want to move on to the VA Veterans Health Administration and medical benefits that you've earned through service. One of the key points I do want to make about VHA, the Veterans Health Administration, is that the VA healthcare system is to be considered a benefit of military service. In no way is the Veterans Health Administration to be considered a health insurance, because it is not. It is there to treat those disabilities that you incurred in service. And they do a wonderful job of treating routine outpatient type conditions. If you can schedule an appointment and make it to appointment within 30 days, there's really nobody better. What the VA is not set up to do is to treat urgent or emergent conditions. If you have an emergency and you got to call an ambulance and the ambulance comes and picks you up, they are not taking you to a VA facility. They are taking you to the closest nearest facility. And there are some very specific rules that apply to all that. Again, without having to try to get in every scenario, you should contact your accredited reps to review all that. But if you can get into the healthcare system and use it as an outpatient service, as a benefit of your military service, and you view it that way, there's really no better. The VA also administers life insurance plans. For example, for recently discharged people, of course, while you were on active duty, you had serviceman group life insurance. When you get out, you have up to 16 months to convert that over to veterans group life insurance. I do recommend it. It's up to $400,000. It's term life, but cheap term life insurance. If you have wife, kids, God forbid anything should ever happen to our vet, but it's a good way to help replace some of that income. So I do recommend it. And the VA administers that program. Of course, your education benefits. Those benefits are administered regionally throughout the country. For our area, they're administered out of Buffalo, New York. Those applications now go right online through the VONAPPS website, VONAPPS. You're probably very familiar with that here. Any questions, we can certainly help you with that. It's kind of an individualized thing, because when you go in to apply it online, you do need to create your own username and password. So we wouldn't want to be a part of that. We'll leave that to you. So that's kind of what we do down and dirty in a nutshell. We refer out to places. Vet needs counseling, for example, of post-traumatic stress, traumatic brain injury, and you would come with us and ask us questions about that. We can refer you out to a local counselor, to the VA, to Maryland's Commitment to Veterans, and of course you're so lucky to have Jade here on campus. We're there just to kind of be we're not the solution to the problem, but if you have a question, hopefully we'll be able to get you the answer. And so you're welcome to call anytime. That's about what I have for you today, and I can take any questions here, and then again, you're free to contact at any time. Thanks for your time. Yes?
Bill, you say that anything above 30% or at 30%, you can add your dependents to it.
Great. So the question is, if you have a service-connected disability rated at 30% or higher, can you add dependents? So it is at 30 or higher. Now, the key thing to keep in mind here is that with the VA, a lot of vets think, well, I should be at 30 or 40. I have 5 conditions here and they're all rated at 10%, why am I not rated at 50%? So VA math kind of comes into play there, and they apply those percentages to a combined rating table. For example, VA 10 and 10 equals 19. And so they apply that to a chart. So don't ever try to add those numbers together exactly. It is applied to a chart, and that's where you get your combined rating. But at 30% or higher, you can add dependent spouse and children. So thanks for the question. Okay. Yes, ma'am.
What other benefits does a disabled veteran get besides their disability pay? I mean,
So it's a great question in that, what are there any other benefits for a disabled vet other than that monetary benefit? And we talked briefly about health care. So one, there is a monetary benefit as we discussed for depending on the level of disability that they assign. Two, remember VA health care. The VA will then treat that condition at no cost for the rest of their life, which is a pretty big deal actually. If you establish that you have a service-connected condition, you can go to the VA to include medication, orthopedic devices, any appliances that they may need. VA provides those all at no cost. There are some other benefits from the state of Maryland, for example, a property tax exemption for those veterans that may be rated at 100% permanently and totally disabled. There's an exemption to their property taxes. So there are, and I've left the checklist is here. There are a number, and they're detailed. So if you're wondering of what benefits you're eligible, you're certainly welcome to contact us, and we'll go through that list with you in detail.
I called a local office in Maryland and I just received my disability letter.
Good.
I retired December 31st last year.
Thank you for your service. What branch of service?
Army.
Oh, that's okay. We'll still help you out.
Thank you. I heard you before the meeting discussing the procedure and stuff like that. My procedure was very easy.
Good.
You know, I got my
Good.
letter back in less than a year.
Good.
But I don't understand it. I don't understand, since I did retire and now I get disability, all I've heard is they offset your retirement pay or your disability pay, and I don't understand it.
They absolutely do that, and I really appreciate the question. The question applies to military retirees. As we mentioned, there is, for disability compensation, there is a monetary benefits associated with it. And military retirees, of course, through disability or 20+ years of military service, you get a pension every month. There is a dollar-for-dollar offset of your military retired pay from disability compensation. So just to use nice round numbers, let's say if your retired pay is $2,000 and you get $2,000 from the VA, you can stop your military retired pay and receive your $2,000 a month from the VA. Your benefit there is all VA monies are non-taxable monies, so you don't pay taxes on that. Back in 2003, Congress added some additional laws to disability compensation. They're called concurrent retired disability pay and combat-related special compensation. One is for combat-related conditions, and the other is for military retirees who have a service-connected disability rating of above 50%. And that's an automatic calculation. So if you file a claim and you receive a benefit of 50% or greater, then the VA, when they make their rating, will automatically send that rating off to DFAS, the Defense Finance and Accounting Service, where they will calculate your concurrent retired disability payment. They'll send that spreadsheet back to VA, and you then will receive both your VA money and a portion of your military retired pay. CRDP, concurrent retired disability pay, is taxable. Doesn't really matter at that point because you're kind of double dipping, if you will. CRSE, which is the combat-related special compensation, is not automatic, and a veteran must apply for that benefit back to their individual branch of service. So if you have a condition related to combat, you must apply through the Army, and the Army has to say, yes, that condition is related to combat. Your benefit there is the CRSE is also non-taxable. So there is a distinction between the two. One combat, which is non-taxable, the other you have to have a rating of above 50%, and that is taxable.
And that's the only way to have the disability and the retirement at the same time.
Correct, correct. That's a very, very detailed thing. And so you do need to get into one of our offices and have them sit down and review that letter with you and go through this process. It can literally take, you mentioned you just received that letter, it can take about 6 months for you to get that calculation for DFAS, then to contact VA and say, okay, here's a military retiree, you've notified us now that they're getting X number of dollars from VA, this is the amount of money that they should also be receiving from CRDP, the Concurrent Retired Disability Pay, with any type of retroactive benefit that may be associated with that. VA then makes that calculate, or confirms that, and they make the payment. So that could take another 6 months from the date of your letter.
All I hear is that I'm gonna be getting less of my retirement pay, which I earned.
You get to make the election, whether you want retired pay or you want your money from the VA. It's in your best interest to take the VA non-taxable. And every year, once you go on CRDP, Concurrent Retired, they'll send you a letter asking you to make the election. And if you don't respond, then they'll always award a greater benefit to you.
Still don't like it. I don't understand why I can't get what I worked for
Right.
and then my compensation.
You know, it's a great question, and I feel you as a military retiree, that at that point, you gotta contact your congressional reps, and that law needs to be changed. You know, so, anyway, yes?
Bill, last thing, if a veteran dies, is there any other benefit other than the burial benefits that are available to the family?
Yes, burial benefits for family, thanks for the question again. The question was, are there any other benefits for the family? And the answer is yes, remember the spouse can be buried. No charge in a VA national cemetery. There's that $600 charge for the state cemetery.
Yeah.
However, we were talking about one of the ways the VA establishes service connection. And one of the ways we talked about was a presumptive provision of VA law. And we talked about exposure to Agent Orange for our Vietnam vets. And that list of presumptive conditions, and there's 15 of them. And there's a lot of common diagnoses on that list. Heart disease, prostate cancer, lung cancer, respiratory cancers, nasty stuff you don't want. But if one of those conditions cause a veteran to pass away, then their passing is then considered service-related. And if a veteran dies of service-related causes, then their spouse or their family is eligible for an annuity payment. It's called dependency indemnity compensation from the VA for the rest of their life. So it's a critical piece. Or, for example, if a veteran establishes they have 100% service-connected disability, and that disability is permanent total, and they have it for 10 years prior to their passing, then their spouse also qualifies for that dependency indemnity compensation. So, you know, this can be life-changing, life-altering stuff, and we still see it every day. And I'm just going to use an example if I can. This happened last week. We had a veteran who lived in Colombia, or a spouse who lived in Colombia. Her husband died 10 years ago, and he was a Vietnam vet, and he died of heart disease. And she, of course, knew nothing of these benefits. So somehow she got in touch with our representative, and he sat down with her and explained all this. He died of heart disease, coronary artery disease, which is one of the presumptive conditions related to his exposure. We filed the claim for the dependency indemnity compensation, which has been awarded. Here's a surviving spouse who had been struggling. She had gotten to a point where she was taking in foster children into her home, and she's into her late 60s, early 70s now, having trouble making ends meet. She took in foster children to help make things meet, and she was struggling with it. I mean, this lady's a little bit older now, and she's not used to dealing with 13, 14, 15-year-old kids. Because of a regulation change within the VA, they went all the way back to 2005 and established that this veteran should have had his service-connected disability back in 2005. Her retroactive payment was over $100,000. and her monthly payment now is $11.95 for the rest of her life, and there'll be yearly cost of living increases. So that's what I'm talking about when we're talking about life-changing stuff. You know, these are things that could have long-lasting impacts throughout the life of a veteran. It's why it's so critical that you get in and work with that rep, that you establish that relationship, that you get on those email lists, so you stay in contact and you know what you're due. We're not giving you anything, you earn this stuff. So,
Phil, thanks for
Yeah.
coming in.
hey Pat, thanks for having me, appreciate your time, and thanks you guys for being here.
Thank you.
Everybody remember to check in on the website. We'll have other information sessions posted, and check us out on Facebook as well as Twitter.